My name is Xuemei Sui. I am currently an assistant professor of the Department of Exercise Science in the University of South Carolina. Our article entitled The Influence of Source of Social Support and the Size of Social Network on All-Cause Mortality will be published in an upcoming issue of the Mayo Clinical Proceedings. I first like to acknowledge and congratulate the excellent effort of my colleagues. The aim of our study was to examine the associations between relative, friend, and partner support, as well as size and source of weekly social network on all-cause mortality during a median 14 years of follow-up among a group of men and women enrolled in the aerobic center longitudinal study. 12,709 individuals, including a little bit over 3,000 women and almost 10,000 men, aged 18 to 19 years, were enrolled in our study between 1990 and 2003. All participants completed a health survey in 1990 when they indicated whether or not they received social support. They also responded how many relatives and friends they had contact with at least once per week. They were then followed until the date of their death or until December 31st, 2003. Our results showed that participants who received social support from relatives or from spouse partner each had a 19% lower risk of all-cause mortality. Receiving social support from friends was not associated with mortality risk. However, participants reporting social contact with 6 or 7 friends on a weekly basis did have a 24% lower mortality risk than those in contact with 1 or less friend. However, contact with 3 or 4 or more than 8 friends was not associated with mortality risk, nor was number of weekly relative contacts. We therefore conclude receiving social support from one's spouse, partner, and relatives and maintaining weekly social interaction with 6 to 7 friends reduced mortality risk. Our findings suggest that source of social relations does matter. Further, source and type of social relations will be very important to consider together in potential intervention efforts to improve health and longevity. Our findings have important implications for chronic disease prevention and treatment efforts. As a source of support, as well as the size of weekly social network, did influence the relationship between social relations and long-term mortality, rather than evaluating changes in social relations as a secondary or tertiary outcome. Clinical and public health interventions should be designed primarily to foster social support and interaction. Therefore, social relations and interactions are vital to human flourishing.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.